all. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So today we have another rock star with us, our own Dr. Z. She is in our comments. Sometimes you see her as Dr. Z. So Dr. Zara Ashikian. She is a PhD, QME, and a clinical psychologist with specialization in forensic and neuropsychology. So Dr. Ashikian, welcome.
Thank you so much, and thank you so much for having me. As I mentioned earlier, Rockstar feels a bit too much given the incredible talent you've had on this channel. I'm just really grateful for the opportunity and the ability to share this little piece of information and knowledge to your audience. Thank
So
you for
as I
having
said, you are one of the rock stars. So thank you very much for being here.
Thank
So
you.
if you're ready, shall we start?
Absolutely.
So tell us a little bit about your practice, your work, and then we go to the topic for today.
Sure. So predominantly, I work within Southern California in Los Angeles and surrounding counties with several different. I hear a repeat. I'm not sure if that's also on your end, but yes, practice seeing adults primarily and conducting evaluations primarily for people who have PTSD and trauma-related issues, depression and anxiety. And I am also a very proud board member of the foundation of Glendale Memorial Hospital. And a lot of the description is also on the site, so you can go ahead and catch up with that or ask any questions you might have. I want to get right into the topic for today.
Awesome. Thank you very much. And apologies that you're hearing the repeat. I will mute my mic while you'll be speaking and it
I
will
see
not be in the
that.
recording.
Okay,
Okay, so I'm going to start with the topic today, and
great.
please take it away.
Okay, so the topic for today is COVID-19 versus lockdowns and which was worse. And I want to go over sort of how I came to collect the information I'll be presenting today, so you have some understanding of where I found the information. So first and foremost is I will not be discussing the impact of COVID-19. I think that's partly been the problem. In fact, one of the studies that I'll discuss a little later addresses the fact that when one of the main things that caused a lot of depression and anxiety in people was the daily number of COVID illnesses and COVID deaths. So you already have that information, so I will not be covering that at all. Our focus today will be the effects of lockdowns. And the topics of discussion will be the mental health, and unfortunately, it has now become very poor. Substance abuse increases during the lockdowns, poor physical health, and abuse of each other. The topics and how I came about it obviously also minimalized because there are for sure effects on careers, education, economics, housing, and so forth. And so I only focused on these four for the sake of time and, I guess, sanity. I wanted to make sure that we were able to discuss the topics a little more thoroughly. And I also primarily focused on studies from journals that are well respected and journals that I usually obtain and get. So these are, and I read a lot, so you'll see there's a really wide range of journals and sites that I obtained the information from, and they tend to be just the information I already had at my fingertips. And again, that's a really big library of journals that I subscribe to, but as you'll see, the results are pretty vast. And I stopped collecting data in late January 2022 and early February 2022, which is when I put this together for our presentation. So I wanted to give you that background information before we get into the topics. So we'll start.
Got it. Thank you very much for pulling this data together.
Sure. So let's start with poor mental health and what we have discovered over the last few, well, I guess 2 years. There is far more significant increases in depression, anxiety, PTSD, complicated grief, loneliness, and sleep problems. You could probably add way more many on the list as well, but again, for time's sake, we're focusing on these issues. So we will, you can change the slide if it's okay. Let's discuss some of the studies that were done. And these were pretty significant studies. Those of you who have been present for some of the presentations that Paul has done and others, you all know already that the number of individuals who are participating in a study is one of the most important things, because we want to make sure this is a representative sample. And in this study, for example, they looked at the Boston University researchers looked at 33,000 college students in the country, and revealed that the prevalence of depression and anxiety in young people had continued to increase from 2020 to 2021, and it was reaching its highest levels. For example, half of the students in fall 2020 screened positive for depression or anxiety. This was a nationwide study that was published last year in February. And the screening continued, and I believe this past year, they revealed that 83% of students said that their mental health was negatively impacted, and that their mental health had negatively impacted their academic performance. Now, for those of you who have been in college or even in school, you know that some anxiety, sadness, ups and downs in school are kind of part of growing up, and it never really affected your academic performance. However, with 83% of students reporting that their mental health crises was so bad that it was starting to affect their academic performance, with 2/3 of the college students struggling with loneliness, feeling isolated, and having all-time high prevalence of social distancing and issues with anxiety and depression. So again, pretty significant. So
Th-
next,
That's that's quite
yeah.
a that's quite an issue for youngsters, especially. I think that I sometimes say to my family members that youngsters are they thrive on touch and interaction and sitting together and going out together and having fun. And all of a sudden they cannot do anything other than being virtual or maybe just at home.
Yes, and it very quickly started to impact their mental health, as you can see. So let's go to the next slide. The Journal of American Medical Association has a subspecialty with psychiatry, and they put together a study of post-traumatic stress in patients after severe COVID-19 infections. The study found that PTSD prevalence with people who had had acute COVID infections was 30.2%. That's pretty significant.
It's a very high number.
That is very, very high. Associated characteristics. So what drove the number up was female sex, delirium, and agitation during the illness itself, as well as more persistent medical symptoms after COVID, long COVID, which is something that you've heard here before. But it was very interesting for me to find this study amongst the studies that I was reviewing, that we can now add PTSD to patients who are struggling with long COVID symptoms. So, and again, pretty significant because PTSD is a disorder, as we've previously discussed, that affects every aspect of the human experience.
And I have a question question for you here.
Mhm.
How will we handle the depression and the psychological impacts that would occur and appear in long COVID patients. I believe we're going to have a lots of long COVID patients. How will we manage them? I don't think our healthcare system is able to recognize and is ready to help.
I completely agree with you. I think the first step will be to make sure that the treaters, family medicine, internal medicine, neurologists, anyone who will be treating the patients for long COVID will also have to have in the back of their mind a screening for depression, anxiety, and PTSD. I will also add suicidality and suicidal ideation, because with any chronic illness, we see the hopelessness and the suicidal ideation increasing. So I think that will also be something that will absolutely have to be part of their assessment.
Absolutely. And to give you, without disclosing who the patient is, of course, one of my patients said to me, youngster, 22, 23, became long COVID, said to me that people think I have anxiety and depression and I am making this all up
Mhm.
and I don't want to live anymore,
Mm.
because in that person's head, people are not able to recognize what they are going through.
Mm.
And as a result, they wanted to commit suicide.
Yeah, that is unfortunately not surprising to hear. It's still very sad to hear, obviously, but not surprising at all. And the individual that you're speaking about is definitely not alone. So I really commend you asking right away, how are we going to make sure that this is recognized and treated? Because it has to be part of the assessment, overall assessment. And whoever is the first person to see the patient who's suffering with long COVID will have to address the impact of the mental health issues. And I don't think it should be looked at as either or, you're having depression and anxiety or long COVID. I think it needs to be seen as both. Of course, you're having depression, anxiety, and PTSD symptoms because you have long COVID, and let's address all of them together. I don't think you can heal one without the other. And I think it will be very important to focus on both. So let's go to
Got
the
it.
next slide. Okay, so more studies. I should have said two things prior to us starting. The first is, after I was done with my research, I noticed a significant decline in my mood. I'm overall a very positive and happy person, but I felt very sad after reviewing all of this. It was a lot of negative information, obviously, and not a very balanced sort of read. So I do want to warn you about the fact that you may start to feel really down after we discuss all the findings of the study. So I want to make sure that you're aware of that and you're expecting it, and know that it's as a result of reviewing these studies. The second is, I want to make sure that you're aware that there's help out there. We are addressing very sensitive topics. Needless to say, this does not come even close to or even implies any kind of a treatment or medical advice or anything at all, except to say, if you're struggling with mental health issues, know two things. First, you're not alone. You probably never before have we not been alone if we're struggling with any kind of stress, anxiety, depression, or PTSD. There are many people in the same boat. And number two, there's help. So please make sure that you're reaching out to family, friends, mental health providers, physicians of any kind to get the help that you need. Okay. So, and I want to go ahead and continue, but I wanted to add that in there just to make sure that we're all aware. So, the American Psychological Association also did a study, and the study contained 3,000 Americans in 2021. And they found that 2/3 of the respondents were sleeping more or less. So they had some sort of insomnia, or either because they were sleeping more or sleeping less than they desired. And nearly 1 in 4 had been drinking more to cope with their stress. Now, I'm not sure how many people are on the feed right now, but 1 in 4 is a huge number. So if you can imagine 25% of whoever is sort of attending this, or when I
So
think
we
about,
are about 200 at this time.
okay, so there you go. So when you think about the numbers, sometimes like I go, oh my gosh, in 4 of my friends, at least one of them, right? Like when you personalize these numbers, it's pretty significant. And so I was very concerned about that, because obviously that leads to more problems later on.
So you're
That
saying that at this time we are 207, 10, including us. There are at least 50, 51 people who may have been experiencing this.
yes, exactly.
So I can raise my hand and say that I've been having sleep disturbances for some time during this whole thing. So I'll just fess up right away.
Right, right. And the fact that 1 in 4 had been drinking more to cope with their stress. And as you know, drinking does not help with stress. And in fact, it's a maladaptive coping that actually ends up causing more stress and even more issues later on, with addiction, which we'll see later. So then the study also found that while 3 in 10 said that their mental health had nosedived. Okay, this was especially true among parents. So that was a very interesting thing for me to find, that parents were experiencing far more stress than their non-parent cohorts, if you kept everything else the same, such as ethnicity, age, race, economic status, socioeconomic status, etc. And compared with adults with no children, parents were more likely to have been diagnosed and treated for a mental health disorder during the time of the study, which was in 2021. The struggles were more pronounced in minority groups, which included 57 African American respondents, 51 Asians, 50 Hispanics, and 47 whites. So I thought this was a very well balanced study. I thought they did a really good job making sure that they had minority groups representative of their sample. And it was very, again, very disheartening to find that minority groups were affected the most. Hispanic adults were most likely to report unwanted changes in their sleep, in physical activity, and weight. And Black Americans were most likely to report concerns about their future. And more than half said that they did not feel comfortable living the way that they had been before the pandemic. So they had significant concerns about contracting COVID and actually having their lives suffer even more as a result of the lockdowns.
And this must have included financial worries, and of course the interaction and those parts as well, right?
Correct, exactly. And all of these studies are available, by the way. If anyone who's attending the talk is needing any of these studies, just let me know, and I'll be glad to shoot you an email with that information. Compared to other adults, essential workers were more than twice as likely to have received mental health diagnosis and treatment since the pandemic. So again, working during these lockdowns felt a lot more stressful to people than those who were not considered essential workers. And I thought that was also another very interesting term. We're going to talk about terminology and so forth during the lockdowns, but I thought that was another thing, the essential workers versus non-essential workers, and how so many people started to feel like their jobs were not purposeful enough during the lockdowns because they were not necessarily considered essential workers and their businesses were closed and such.
Wow, that is profound. So yeah, of course, the word essential worker,
Correct.
and if somebody is not in essential worker group, they would feel bad that I am not an essential worker.
Yes.
Yes.
There was a significant amount of decline in their mood, in their self-esteem, in their prospects for future employment and such. if they were considered non-essential and basically told you can't work, you're not contributing greatly to the society. So let's go to the next slide. Okay. So symptoms of anxiety and or depressive disorder and use of mental health care among adults during the pandemic was assessed from August 2020 to February 2021, and in January 8 is when this was printed, and again this was in JAMA. During that period of time, the percentage of symptoms of anxiety and depressive disorder during the past 7 days. So they took the sample of individuals and they said, during the past 7 days, how many symptoms of anxiety and depressive disorder have you had? So it ranged from 36% to 41%, as did the percentage of reporting that they needed but did not receive mental health counseling or therapy during the past 4 weeks. That was actually more heartbreaking than knowing that people were struggling, because I always think, okay, well, we can't prevent people from having problems, but we can help them solve them. And that was very heartbreaking to know that that was not being done. And let's see, the largest increases were individuals from 18 to 29 years old. And this has actually been with less than high school education. So this was rather interesting for me to find, because I thought that individuals who were older and possibly even more isolated would have far more increase in their mental health issues such as depression and anxiety. But it was a very interesting find for me, at least, to find that the younger individuals, who are usually considered more resilient, were the ones who were struggling far more during the lockdowns.
And is there, I mean, I can understand that, for example, I am in now above 50. 2 years into pandemic, I went from 50 to 52. And I used to feel this, that all right, I'm in that age group where we don't know what can happen if the COVID hits you.
Mhm.
There was a general discussion that youngsters are relatively more protected. Why was this more prevalent in youngsters then?
It was actually, again, the impact of the lockdowns, not so much COVID itself, right? It was the fact that there was significant social isolation, there was significant decline in education and their prospects. There was almost no athletic activity. So if individuals were in sports or in any kind of social groups, organizations, theater groups and acting groups, or any other sort of a social activity, those were all shut down, at least for the majority of the United States, for the majority of the time for the last 2 years. And that was one of the most significant contributions of this stress and so forth. And in these
Got it.
groups as well, it was the social isolation, lack of going out, travel, dating, and so forth, that pretty much resulted in that. And this was another very interesting finding. If you could go back, the last one I wanted to share, 90% of the US registered voters said that US faces a full-blown mental health crisis. Nearly 2 years into the pandemic, the rise of depression, anxiety, stress, addiction, and other challenges, almost 9 in 10, again, 90%, said that there is absolutely a mental health crisis in the nation. I don't know of a single country that's ready for 90% of their adult population to experience a mental health crisis. And it seems like voters are telling us that that's definitely the case. That's what they feel like is happening. It's profound.
This is a crisis.
Yeah.
And I will repeat it. I said it before, I'll repeat it. The patient that was suicidal, their problem was not that they are depressed. The problem was they have long COVID, and people say it is depression, including my doctor.
Mhm.
and I am making it up not to go to work. And that had added a lot more stress to the point to say, you know what, life is not worth it.
Yeah, absolutely. Being believed, being understood, and being heard are very much part of the healing process. I'm certain you've experienced this with your patients as well. When you tell a patient, this is what's going on, and they finally have an explanation for why they're experiencing the symptoms that they're experiencing, it's almost like 25% of the healing is done already, just being able to name and understand what's going on. Would you agree?
100%. I mean, during the whole COVID time, I think that the most important service that was done, people heard a lot of news that today this has happened and tomorrow that has happened, but understanding so that they can think about it,
Right.
the kind of service that we did, I thought that had changed a lot of people's perspective and
Right.
helped even against depressions. So I totally believe in it. Otherwise, I would not have done it for 2 years.
Yeah, absolutely. And so here's a bit more information. The emergency room visits for mental health crises among 12 to 17-year-olds increased 31% between 2019 and 2020. That's from the CDC, you guys. Okay, 31% increase to emergency rooms, right? So generally speaking, we think about going to the emergency room as a last resort, and especially during the pandemic, right? Or things really have to have accelerated significantly for us to consider that. And among the same age group, again, 12 to 17, the emergency room visits for suspected suicide attempts rose by 22% last summer. That means 2020, compared with the previous year, and 39% this past winter. That means 2021, compared to the previous winter.
That that is disastrous.
Yeah, that was again one of the chilling findings of the studies. And I'm not skipping. I know that I didn't cover the first one. For time's sake, we will put them up and then just discuss some of them. Obviously, you're free to read the rest of them. The depression levels and the increase. And again, I want to call to attention that is not the actual percentage of visits. That is the increase by how much they increased during summer and winter. And
That is serious.
right. And obviously, with these issues, there's always the fear of underreporting. There's definitely people who did not go into the emergency room that did not have such a serious attempt that would have resulted in a transfer to the emergency room. So that's again an underestimation.
Got
Um,
it.
And again, the last one, we'll read that before we move on, is 27.8% of adults in early months of the pandemic and 8.5% before the pandemic were the numbers for the depression. And it had gone up to 32.8% in 2021. So again, and that's for adults. And that was in the Lancet Regional Health. And it was published on January 1st, 2022. That was a very good study, actually, and it should be free online available if anyone wants to check it out. So we
32.8% of US adults experienced elevated depressive symptoms. Wow.
correct compared to what it had been before. Yeah,
Hmm.
so pretty significant findings again.
Hmm.
So we can go to the next one. And some more data from the Lancet study that was actually, this one was published on October 8th, the global prevalence and burden of depressive and anxiety disorders. This was actually one of the most interesting studies. They included 204 countries. And I wanted to include this because I know that Dr. Bean has a very international audience. So not just to focus in the United States, but the study looked at 204 countries and territories in 2020. And this is the study that found that the two of the major sort of contributors to people's anxiety and depressive disorders were the daily number count for the COVID infections and deaths and lockdowns. So the reduction in human activity. Those were the two major causes of increases in depression and anxiety in all of the 204 countries and territories. And females were more affected by the pandemic than males for major depressive disorder, and younger age groups, again, younger age groups were more affected than older age groups. I do want to call attention to a lot of the studies that found females more affected than males. Generally speaking, females tend to report more psychological distress than males. So I do want to ask you guys to keep that in mind. Sometimes the difference is not very significant between the two genders because of that issue, because of reporting, not necessarily experiencing. So, but I did
Got
want
it.
to make that distinction.
Got
So,
it. But this is so the two main factors
correct.
infection. Is this that daily reporting of the infection numbers?
That's correct. That's correct. Basically, the
Wow.
information that the news had, kind of like streaming, regardless of what they were reporting on, the streaming numbers of individuals who had contracted the illness and the individuals who had died from the illness being reported on daily basis throughout the day, every single day.
Wow.
That
And every outlet was just inundating people with the numbers.
correct. And that was one of the major contributors of depression and anxiety. So
Got it.
pretty significant. So let's go to the next one. So now we're going to change topics to talking about substance abuse. We already discussed one study that found that 1 in 4 individuals who was experiencing sleep problems was drinking to help them sleep and reduce their stress. So looking at, again, alcohol use, drug use, abuse, and overdoses, this study is not included in these slides, but I want to say early February is when the study regarding overdose deaths came out. And it was estimated that over 100,000 people in the United States had passed away from overdose of drugs. And again, that is definitely a number you want to think about as an underreporting, because most of the time, unfortunately, deaths are not reported as overdoses. Deaths are not reported as drug related at all, especially when an individual passes away alone or was homeless and didn't have family and so forth. Sometimes even autopsies are not necessarily done on individuals. So that is definitely an underreported number, but it was 100,000, over 100,000, and it was found to have been the highest ever in the United States, percentage wise. So, and that's pretty significant.
And that 100,000 overdoses, that was in addition to the normal baseline numbers, meaning could that be attributed to the circumstances of COVID or?
It was, they didn't have that kind of thorough data gathering as to what it was about, but it was definitely not the so they tried to separate suicide versus overdose, right? And so if someone's death was not absolutely ruled as a suicide from overdose, then it was considered as an overdose death. And so I interpreted that as accidental overdoses, accidental or incidental, and not voluntary overdoses.
Got it. And can I ask you a question before we continue?
Mhm.
If anyone who is listening, if they're feeling depressed, as you had already said, should they stop watching, or know that there is help available? What is the best way um, to digest this, or to avoid this, or what should be the behavior?
Absolutely. I think with anything that you're watching, whether it's this live show or the news or anything else, if you're having an emotional reaction that you don't like, you don't appreciate, it's too intense, turning it off. If you'd like to return later, that's totally fine. But obviously, turning it off and walking away, and then immediately either reaching out for help, talking to a friend, or doing something that will lift your mood. Again, that would mean that you are not necessarily experiencing that negative emotion, but that it's brought up by this. And again, we're talking about pretty heavy topics. We're talking about really sensitive issues, so I definitely want to welcome you guys to walk away, b get help, talk to someone, and then turn to something that's less sadness provoking, possibly a comedy, stand-up comedy. That would be very helpful. But also, if you skip ahead and come back later, we're going to talk about how to deal with it and how to turn things around, how to become more resilient for the future as well. So if
Got it. Thank you.
great, that's a great interjection. Thank you.
Thank you.
So let's go to the next slide. And again, for time's sake, we'll be going through only some of them. As I mentioned, there was a pretty significant increase in alcohol dependence seen during the pandemic. The AUD, I believe, is alcohol use disorders in UK, and the study found that worse outcomes from COVID with more mental health problems. And this was a June 2021 study. Alcohol dependence admissions increased from 3% pre-pandemic to 3.7% during the pandemic. And this was a significant increase, as you can see, with the P of 0.001, because at first, when you look at it, it's 0.7, but that's significant at that P level. So that's pretty significant, with patients hospitalized with alcohol use disorders having a 16-fold increased risk of mental health issues and behavioral problems. And this was reported by the University of Nottingham in England. So this was not a particular country issue. This was seen worldwide, and that was just one study from the UK. So we can go to the next one. This is again JAMA Psychiatry, which included the hidden epidemic of opioid overdoses during the coronavirus pandemic. 42% more opioid overdoses in May 2020 compared with May 2019. That's just 1 year. And 42% is almost 50% increase. And their suggestion was that we need an anti-fentanyl vaccine. I think that's their next task. And the March to July 2020 compared with 2019 during that same period of time. So just what is that, like 5 months? Opioid overdose emergency department admissions more than doubled, while other emergency department admissions dropped by 29%. So again, if you remember back during that period of time, there wasn't a lot of people going to the emergency room for anything other than COVID related.
Absolutely.
And that's presented in the 29% decrease in other issues being reported to emergency department visits, but a more than double visits related to opioid overdoses. And that's just opioid overdose. So one drug category that does not include alcohol, that does not include cocaine and more of the uppers. That's just opioids.
And talking about the avoiding emergency, even heart attack rates dropped because people will not go to the hospital.
Yes. So we can go to the next slide. Okay, so fentanyl in the United States is what was often made by Mexican cartels using a precursor chemicals from China, and this is from the drug DEA, the Drug Enforcement Administration. It took off in the East faster, and in part because of the region's longstanding problem with opioids, and then moved west. And the last part was really, really sad. So obviously, COVID cannot be the complete cause of the fentanyl sort of issues in the United States, but it clearly moved the needle far faster. If you can look at the overdose deaths in San Francisco, increased 173% between 2018 and 2020. I would imagine that number going up far more between 2020 and 2022. And that study is being done, but it wasn't ready for print yet.
Wow, that's a very sad situation.
Yeah, absolutely. So we can go to the next slide. So again, continuing with substance abuse, the pandemic compounded the overdose issue with a lot of isolation, stress, job loss, homelessness, shelters being closed or really restricted, with living spaces being restricted and so forth. And also a lot of the AA and NA groups were either completely canceled or moved online, and a lot of people didn't have access to it, unfortunately. So I personally had several patients who just stopped attending those groups altogether. So, and it was this is the study that was upgraded later. So this is the study that found that it was projected that 88,000 and so on people died from overdose in the past 12-month period. And this was the study that was updated to over 100,000 by the time it was printed in January 2022. And again, as you can see, in Seattle area, overdose deaths involving fentanyl were up 57% in 2020 over the previous year. So again, this is a 57% increase, not 57%. Between 2019 and 2020. I mean, can we afford that increase over the next 2 years? That's
That will be, that will be,
alarming.
yeah.
Yeah. And then there's a Vegas data as well. So preliminary data, deaths from the synthetic opioids like fentanyl rose 162% in Las Vegas area last year, and that was in 2021. So between 2020 and 2021, there was 162% increase. Wow.
Wow. So the question I have is, we were in the lockdown, so the people interactions were less. How did people get more substance? Is it the people who already had access to it, they started overdosing, or somehow people who are in the houses were reached as well through networks and whatever way it spreads?
Correct. I don't know of any studies that looked at that. Actually, the availability was pretty open to just about like the age groups also that they discussed. The age groups ranged from 12 to 60 or more in some cases, obviously with the bell curve sort of being in the middle. And I think the fact that it became far more available and readily made it very easy for people to obtain it. Definitely.
Got it. Got it.
And
Thank you.
unfortunately, the places that were closed were people's workplaces, schools, gyms, and social networks, which were probably how people avoided getting those drugs and using them, because there would be people around them who would notice that they were under the influence.
So it almost became a perfect storm for some people.
Correct. Unfortunately.
Mm.
So we can continue. So just a few more to share. In Los Angeles County, recent report blamed fentanyl for a 26% jump. Again, this is an increase in overdose deaths among the homeless population during the first 7 months of 2020. That's just 7 months. And the problem is particularly high in San Francisco. When I was reading the findings in San Francisco, I remember that it's one of your favorite cities, and how
I
much
love it.
it has changed from the time that you probably fell in love with it. Because I know for me, it has changed just in the last several, maybe 10 years. So this was a record that 708 people died of drug overdoses in 2020, a 61% increase from the previous year. Um, this was pretty significant. And then lastly, so far this year, this was in 2021, has been the worst, with 135 dying of overdose just in 1 month, right? And
That
and
is
they were,
sad.
yeah. So the in 2020, 708, and 135 already in 1 month. So yeah, pretty significant. So if we can go to the next slide. Poor physical health. So we talked about gyms being closed, parks being closed, beaches being closed. If you lived by the beach, that made no logical sense, at least to me. I'm obviously open to being, I'm willing to change my mind if someone can convince me otherwise. But the reduced activity, increased weight, and increased health issues and lack of preventative care. One of the presenters that you've had here that I've really appreciated is the specialist on diabetes. I've enjoyed her talks so much. And again, that's one of the illnesses that's on the rise, and it might be really hard to parse out the reasons. Was it the increased weight? Was it the poor eating habits, lack of movement? And also, I believe you said COVID illness was also itself found to be linked to a higher risk. Am I right?
Absolutely. Yes. Yes.
Yeah.
And to add my own little stories here and there, the uh, gym that I used to go to, they not only closed it, of course, they were not making any money because, or less money because people were not coming in. So not only they closed it, they just raised it. And now they're making an apartment complex there. So
Mhm.
it's gone. I have to figure out where to go now. And I think the
No.
next closest gym is 10 miles away or so.
Wow. Yeah, that's definitely a concern. And again, as we'll see with some of the studies, just the how significantly poor our health is. And I think I was reading it either in a recent Forbes magazine or the Wall Street Journal, that the entire world is now in far poor health than it had been over the last 20 years. And I
That's
don't
sad.
even think we needed a study to figure that one out. I definitely think that all of those issues, the reduced activity, increased weight, increased health issues, and lack of preventative care made our health far poorer than before.
And so I brought you to the main for a second. I was talking with a friend and I was saying that we actually do not yet realize the collective damage that has occurred. It's not only the people got COVID and died, there is more. The one who are remaining,
Hmm. Hmm.
there there will have to be a looking back and understanding the impact. I think at this time we are shell shocked, and
Hmm.
I think there is a lot of impact.
I completely agree with you. And as we will see with the studies that were done, the I think the actual impact will be seen in 5 or 10 years. My biggest concern being the late discoveries of cancers. And that was very obvious in the first 6 months of the year, when all of my friends who are gynecologists, nephrologists, cardiologists, internists, kept having all this free time and not having a single patient in their offices. I myself called my doctor to make an appointment for my regular physical during the summer, and the girls who answered said, "Oh, well, when do you want to come in?" And I said, "Oh, no, no, no special treatment, just whatever is available." And they said, "Well, that's what I mean. When do you want to come in? We Everything is available." And that was my first sort of, oh my gosh, people are not going in for preventative care. They're not getting mammograms. They're not getting colonoscopies. They're not getting any of the age appropriate, gender appropriate tests that we do every year, that we should do every year. So that's my biggest concern, is a significant increase in late onset cancers. I hope I'm
That's
wrong.
scary. Yeah, yeah, and you're correct. My doctor had asked me once to come in, and I had said no, I'm not coming in. Although
No.
I've gone twice, but at that time I had said I am just staying home at this time.
Hmm.
So I'm sure that I'm not alone in doing that.
I can definitely tell you, in my doctor's office, I had never seen the waiting room chair colors ever, because they were always packed with people, and it was completely empty when I went in July 2020. So
Wow.
let's look at some of the findings of the studies. And so this was the study I initially talked about from the APA that looked at 3,000 adults, and in the United States. Since the pandemic began, 6 in 10 respondents said that they had undesired weight, with 42% gaining more weight than they had intended. And it ranged for like an average of 29 pounds. And again, this was an average, so some gained more, some gained less. Of those who gained, half put on at least 15 pounds, and 1 in 10 gained more than 50 pounds. So again, 1 in 10. Let's personalize that. How many people are on the stream? 1 in 10. That's pretty significant, right? If you personalize it, that the numbers become a lot more relative and a lot less, oh, this was other people. No, it was us. It was all of us.
I
Meanwhile,
gained 14 pounds. I
no.
don't go near my weighing machine now because I didn't want these 14 pounds.
Well, we're having this talk so we can turn things around. And so, and I'm going through these a lot faster so that we can come to that. So, let's see. Sitting was linked to increased feelings of depression and anxiety. This was a study published in 2021. And we were doing that more than any other time in our lives. Let's see. A survey of participants who were meeting in the United States physical activity guidelines, 2.5 to 5 hours, which is a moderate to vigorous physical activity before the pandemic, decreased their physical activity by 32% on average shortly after the restrictions were instilled. So
Wow.
that's pretty significant, right? And again, that's just moderate to vigorous activity. These were not like the athlete levels who just dropped by 32% and were sort of moderately working out. These were just regular folks who dropped down by 32%.
So, this current situation where the countries and communities are opening up, it
Mhm.
is actually going to be starting to become positive for many of us.
Absolutely. Absolutely. Reversing
Uh,
those negative impacts.
right. And I realize that there can be a risk for people going out who may be at risk. So, those who are at risk, they should take care. But generally, from all of these studies, it seemed like once people can start going out and moving about and interacting and going to gyms, it would actually start helping at least little bit.
Absolutely. And I think that it doesn't necessarily need to involve the risk of contracting COVID. You can definitely choose to go for a walk during times that you would not run into too many people. You can definitely try to exercise at home. There are numerous streaming programs, even free ones online. Ability to purchase equipment if you're able to, obviously, to be able to work out at home. I generally find that there's no excuse to not work out. I've never met anyone. Needless to say, I've dealt with significant number of really resilient individuals, athletes with injuries and so forth. So I guess I have that as the standard. It's kind of like, well, if a veteran with amputated arms or legs can find a way to exercise, then I think we're just out of excuses altogether. So I think it's really important to stop looking for excuses and start looking for ways to integrate physical activity into our lives, because it's
Got
very,
it.
very important.
Got
So,
it.
and the same participants who had dropped their physical activity reported feeling more depressed, anxious, and lonely. So again, I know that a lot of people who have sometimes talked about being physically active as a way to improve their mood have gotten a lot of negative sort of responses, that you don't treat mental illness with exercise. Not necessarily, but it definitely helps. So and this obviously shows that those individuals who dropped their physical activity significantly had more depression, anxiety, and loneliness. So everything else held aside. Obviously, as you know, with studies, you want to make sure that all the other variables are held constant, and those were that was the leading factor in their development of depression, anxiety, and loneliness. So we can move on. Here's more.
Got it. And
Um,
just a clarification that sometimes my reaction is a little delayed
uh-huh.
because I have put myself on mute. So I go from this screen to that screen and unmute myself and then I speak. So there is a pause sometimes between them. So just so that you're not saying, what the heck?
No, no. I figured as much because I stopped hearing the echoing. So I know that that's what's going on. I did want to ask you about this, and maybe some get a conversation started about this. So there was a study that found that babies born during the pandemic showed slight developmental delays that were not related to in vitro exposure to COVID. And the doctors that did the study sort of hypothesized that it could be related to maternal stress during the pandemic. um, I thought that was really significant, because then you can see the generational impacts of the lockdowns, and,
Absolutely.
and that is really, really concerning. um, So, and then the American Medical Association of Pediatrics found that there was found no signal to suggest that exposure to COVID itself in the womb was linked to the neurodevelopmental deficits. Instead, it was rather the stress that the mother was experiencing. And again, not having had COVID, not having had an individual in their life died of COVID, and so on and so forth. So it was the secondary things, indirect things related to COVID.
And a possibility, meaning stress itself directly would not affect the child, but during the stress, the hormonal systems will
Correct.
become very much different. The steroid release, epinephrine release, other stress hormone release, the insulin's behavior, glucagon's behavior. So glucagon goes up, blood sugar levels become different. So if those continue to happen consistently, that
Mhm.
will create an impact for the baby as well.
Absolutely, absolutely. And sleep obviously will be impacted. maladaptive coping. We just not being able to cope with the stress during the pandemic and so on. So that was another very interesting and rather concerning finding. And then in November 2021, again in JAMA, there were findings that between risk factors, heart disease. So you wanted to talk about heart disease. So 24,767 patients from 52 different countries were studied. They found that patients who experienced high levels of psychological distress during the year before they entered the study were more than twice, 2.5 times, likely to suffer a heart attack during an average follow up of 5 years, even when traditional risk factors were taken into account.
And I think that you would probably not want to comment on this comment that I'm going to say. I think that lockdowns and the disease itself is one factor or one set of factors. And
Mhm.
then take a vaccine, don't take a vaccine, shaming, embarrassing, yelling at each other, putting down each other, uh, not thinking that our healthcare authorities are friendly to everyone and a clear boundaries are made and clear groups are made. I think these themselves were also contributions to people's situation. And again, I'm not looking for your comment on that because this could be um, a little controversial, but I think that those things also added to the stress.
I don't have any problem admitting to that because we have patients at the clinic with those stress factors in their workplaces, in their homes, with their family members, even of just being very, very divided, not having a lot of trust in public health officials or their doctors, knowing that their doctors are being censored, knowing that their doctors are not able to prescribe a certain thing or say a certain thing or explain a certain thing clearly. When people, I know several individuals who have allergies and they wanted to know, simply know, do the vaccines contain X, Y, and Z? I'm allergic to it, right? For example, when you go to a doctor, they'll ask you, what do you have allergies to? Because they don't want to give you penicillin, for example, if you have an allergy to penicillin. And their doctor is just not wanting to ask any questions, simply refusing and referring them to websites such as the Walgreens website, where you make an appointment to get your vaccine, to get some information about the vaccine. And so there was a significant reduction in trust and ability to feel comfortable with individuals, and that was a huge factor as well, indeed.
And I'll give you another example. A person here, so not my patient, a
Mhm.
person here called me, older individual. She said for her way life, her health insurance structure, she cannot go to a different doctor than the one that is assigned to her.
Mhm.
And she said, I was asking some questions for vaccination because I had some concerns.
Mhm.
And my doctor said, let's agree to disagree on the questions that you have and not talk about it anymore. So she said, I decided not to have the vaccine because I didn't have the answers and I cannot go to another doctor to get
Mhm.
the help. This is how much uh, youngsters are getting impacted by isolation and lockdowns. Uh,
Mhm.
Older individuals are not able to get their questions. Society is clearly divided in groups, and even healthcare authorities are taking. You are not a, again, this is not for you, this is me. You're not a horse, you're not a cow. This is the way to talk to your own people who actually
Right.
afford to make you and build your agency and pay for your work. This is the kind of environment that was created.
True.
Anyway, sorry for my rant.
No, it's very timely. It's very timely, and very well taken. So a 2.5% increase in heart attack, simply because they also reported co-occurring psychological distress. And again, all other factors that would otherwise contribute to a heart attack, such as family history, high cholesterol levels, and so on and so forth, were traditional risks were all taken into account. So pretty significant. What is that movie called? As Good as It Gets. Yes, stress can cause a heart attack.
Yeah.
So let's go to the next slide.
And by the way, I'm totally bad for the movies. I can so to tell you something funny, just maybe to lighten up people's mood as well. This weekend, I decided to watch something. So I
Okay.
started watching a movie, and my wife uh, came in and she said, "What are you watching?" And I said, "I'm watching this movie. It's interesting." And she said, "You have already watched it twice, but I'm sure you're going to enjoy it again because I can just do it."
That's funny. No, As Good as It Gets. That's a pretty funny movie. So it may be the perfect movie to watch right after this talk. So
Will do.
yeah. Abuse of each other, and this is our last topic. And again, there was a significant increase in domestic and relational violence, elder abuse, and child abuse. And so a very large group of the patients that I treat, that my clinics treat, are police officers and firefighters and first responders. They actually make up a very large population of our clinic. And the amount of calls that they were responding to that were related to elder abuse, child abuse, overdose, domestic violence, and relational violence was pretty significant. And they were all very, very impacted by it. So when I was reading these studies, I almost didn't need to read the studies that were related to this, because I had heard our patients over and over reporting these issues as things that they were dealing with, as things that they were just completely fatigued by. So let's look at some of the numbers. And again, we won't spend too much time on it. So domestic violence incidents rose in the United States about 8.1% after the imposition of the lockdowns. And this was again, according to the National Commission on COVID and Criminal Justice. I did not even know there was such a organization, but apparently there is. And that's what they found. Now, I also want to let you guys know, this is another area where all the reported information is going to be an under-reporting. These issues go underreported very, very much on good times. So you can imagine that during lockdowns, during isolation, this was far, far more underreported. So the United Nations referred to the rise of domestic violence and domestic abuse as the shadow pandemic. I don't know how you guys feel about it, but I think it might have been better to call it the spotlight pandemic. I wanted this to get more attention, more funding, and more help. The National Domestic Violence Hotline reported a 9% increase in emergency calls during the months, just during the months of March through May, when the lockdown orders were issued. And again, underreporting. Any number that you see, multiply it by a couple of tens.
And
Um,
I heard that children suffered a lot as well during this time.
Correct. Absolutely. Mandated reporters, when you think about it, they're teachers, school administration, and so forth, for any kind of suspected child abuse, and child therapists. And if the child was seeing anyone, it was online. Um, on Even on regular days, it's very easy to hide bruises. Sometimes the abuser is very strategic and unfortunately where they hit or abuse in any way. So you can imagine that it was a lot harder to observe those issues than during regular times. So yes, unfortunately, I agree that child abuse also increased. Police departments responded to increased domestic violence cases around the country by 18% in San Antonio, 22% in Portland, 10% in New York. Again, these are increases, not the actual numbers. And this was in the American Journal of Emergency Medicine. And
That's
again,
sad.
for sure, an underreported fact.
This is sad. It makes me sad to see this. And these are, again, as you're saying, these are the numbers that are reported.
Correct.
How much abuse has gone on, has happened, is happening, where there is no inkling to anyone.
Yes, definitely a significant issue. They did try to, if people were at school or under county services like LA County Services or public services, there was a lot more outreach. But again, a lot of it was over the phone, probably right next to the abuser. So again, not reported, not found out, and so forth. So if you know of anyone who's struggling with any of these issues, please reach out to the National Domestic Violence Hotline. I will forward all the phone numbers for Dr. Bean to post under the description of this video. But needless to say, if you have access to the internet, you have access to Google or any other search engine, and you can simply search for these numbers. They're very, very easy to find.
Got it. Thank you very much.
Absolutely. So let's move along. There was also an increase in elder abuse. 1 in 5 older people reported elder abuse during the pandemic. Again, 1 in 5. That's pretty outrageously significant. And this was a jump of 84% pre-pandemic. Again, underreporting. So again, couch that under the umbrella of underreported numbers. There was
And
also
I had always worried about the elderly in the nursing homes
Mhm.
because over there, sometimes people lose patience faster. Um, is this is there any study for the situation in the nursing homes versus a regular household?
There was no differentiation in this particular study, but that would be a very interesting thing to find out. I'm not sure how open nursing homes were to individuals doing any kind of studies, and how they would go about having access to those individuals. But I do think that these were not individuals who were actually in nursing facilities at all.
Got it. Thank you.
There was also a rise in the incidence of abusive head trauma during COVID-19 in the UK of 167% from 2020 to 2021, compared to the prior 3 years.
That is serious. Head trauma can cause lifelong damage or death.
Or death, exactly. The lockdowns, school closures, and movement restrictions have left far too many children stuck with their abusers without safe space that school would have normally offered. And it's very urgent to scale up efforts to protect children during these times and beyond. And that was one of the study authors who commented, and I think we're late to do that. We really need to up the game of that. So we can continue and possibly wrap this portion up. Let's see. Healing and resilience. So if there are any questions about any of the information that we covered early on, we'll definitely take them. But I do want to go on and talk about how we heal and how we become resilient.
Let's do this part, and maybe we can do another session later on. I want people to have this part packaged up as well, so that they know what to do next?
Absolutely. I agree with you. And we can elaborate on any of these issues. And there are some, for example, sleep. I want to definitely make extra time for that one, and talk about the sleep clinic and the treatment for that. So let's talk about the first and far more important, maybe I shouldn't say far more, but very, very important. So if you walk away with doing anything different from today's talk, I hope it is to schedule and attend a physical checkup, right? And that means a full lab work, and all the proper exams, vision, labs, scans, whatever is appropriate for your age group, for your particular individual health needs. Okay. So I know that for some of you it's evening, for some of you it's morning, but the next business day, I want everyone to get on a phone, make these appointments, and attend them. It's very, very important. And make sure that the labs also include your vitamin Ds and all your A1Cs, which is your glucose levels over the last 3 months. It's a more comprehensive glucose reading than just your regular glucose reading that day. So I want to hold all of you responsible to this particular one. Okay. Would you agree it's one of the important ones, Dr. Bean?
So I am already thinking about
You made
reaching out to my
notes.
doctor in the morning to say, can I please come in for the physical? So absolutely. I think this point that you made about the diabetes, sometimes we don't even check because we're afraid that the numbers may not be correct. But at some point, we got to face whatever is going on in our body so we can get ahead of it quickly. And we've been so drowned with the COVID and COVID related matters that are live. And so not only we have lost so much time, but we have also lost so much of the care for our own selves, and these things are going to hurt us. So you're very, very correct, and I am going to do it right in the morning.
Wonderful. I appreciate that so much. And also, there are certain items that you will actually not have your doctor just tick off by themselves. And I want to highlight the A1C is not something that they automatically check in a lot of countries, in a lot of states. So make sure that you ask for that particular test, and also your vitamin D levels as well, and ask for any of your thyroid. That's another one that's very, very important. Thyroid hyperthyroidism can mimic anxiety disorders. Hypothyroidism can mimic depression. So you definitely want to first make sure that no physiological issue is causing any of the symptoms that you're experiencing, any of the difficulties that you're experiencing. They can also be the reason why you're gaining unnecessary weight or losing unnecessary weight. So you definitely want to have those checked out as well. So I really want you guys to make sure that you do that at the earliest availability. And I hope you all get amazingly good results. But I definitely want you guys to go ahead and take care of that. Okay. I think the next one up would be to develop and maintain a routine for physical activity. Again, I have had the honor of working with many athletes, many veterans, and people who have suffered incredible injuries and have overcome significant physical issues and injuries. And I always hold myself against these individuals who have not only overcome such great physical limitations, but have continued to remain physically active and healthy. And so that's why I give myself no excuses, because I have these incredible role models. And I really want to welcome you guys to also adopt such mentors and heroes and really focus on your health and well-being without excuses, and really prioritizing physical activity, movement of any amount. You'd be surprised to know all you have to do is get in 15 minutes of heart raising exercise. that means you lose your breath. So heart raising. Now we lose our breath at different intervals. So for one person, it could be jumping rope for 15 minutes. For another person, it could be a very brisk walk. So you want to make sure that you get your heart rate up to a certain point where you lose your breath for about 15 minutes, 5 days a week. That's all it takes, 15 minutes. It's really, really short period of time. We've been here for almost an hour and 22 minutes, just 15 minutes. Okay. So let's see, what's the next one, Dr. Irvine? Fuel better. This is one of my favorite topics to talk about. Now, if you have hopes of driving an amazingly great sports car, or if you've ever driven an incredibly great sports car, you would not put really cheap fuel in that car, because you know how important it is for that machine to have the proper fuel. Well, we're really not that different. We have a mechanism that needs to run a certain way, and it needs to be fueled a certain way. At least in the United States, most insurance companies will cover preventative care with a dietitian or a nutritionist. So I encourage you guys to find out what those services are available to you. And even if they're not available to you, stores like Whole Foods, Trader Joe's have health consultants you can meet with to find out what are some of the really powerful foods and ingredients that you can have. And I think Dr. Bean is considering talks surrounding that as well. So I really want to welcome you guys to think about adding a little more knowledge and also integrating that knowledge. Sometimes it's not the fact that we don't know what we need to do, it's the fact that we just need to do what we need to do. So I want to encourage you guys to fuel better. And if you don't know how to do that, I encourage you guys to learn and to really make sure that you're fueling your body the way that your body needs to in order to run the correct way for yourself. And let's go to sleep better.
And just a quick addition for the fuel better, we'll have Dr. Giles Yo with us on this 25th. And Dr. Priya has been here as well. This was one of the things that I wanted to put in front of the audience, cool beans, to see how do we become better with this better fuel. And this is not only just for me, but I think that we all can take advantage of that. So he is one of the top nutrition and calorie and the appetite and the management obesity and genetics. He's one of the top guys in the world, and I am so grateful to him that just like you, he has decided to come in. So
Oh,
thank
that's
you very much.
wonderful. That's wonderful. Yes, I completely agree. I really truly believe that the way you fuel your body dictates how you feel, how you think, and so forth. I'm constantly teased by my friends and my family that I say I don't get tired. I don't get tired. I know that for a lot of people, that's not something that they end up believing, but I don't. And so a lot of people, when at first the COVID symptoms came on and they said fatigue, I said, oh shoot, I'm gonna miss that. I don't know what that feels like. So I truly believe the way that you fuel your body has a lot to do with it. And I wholeheartedly appreciate you having him on. That is going to be one of the most powerful talks.
And we need your menu items so we can feel that way.
I would love to share it, but it's a Mediterranean diet, so it's really not very. It's really not that.
By the way, I love Mediterranean diet. I love
Yeah,
it.
it's an incredible energy and fuel. And like I said, I'm constantly teased, and I say I don't even know what the word means, and then of course I get teased that I'm a doctor and I don't know what tired means. But I even will prove by the fact that there's no brain proof of tired. You can't see tired, you can't feel tired, except for when you utter the words I am tired. That's when you feel tired, and of course if you're eating the wrong foods. So
That
I'm
means I need to do more talks. I cannot say
yes,
I'm tired now and finish the talks.
you
Oh
cannot
man.
say
Okay.
tired, not at all. So let's go on to the next topic, which I think is everybody's favorite: sleep better. This can be very much linked to feeling better. So I think the two topics are very connected. I do think that sleep needs a topic of its own, a presentation of its own. And I will be glad to put together something or have a sleep doctor as well join us. But the fact
I
that
would
we are
love that.
actually, okay,
I
perfect.
would love that. I'm
Okay,
gonna
so
bug you for that one.
okay, I would love to do that here because again, our brain is made to sleep, right? The studies that were done where they held people, the studies that were done before there were human subjects committees that approved studies, included a study on sleep where they took individuals, very healthy college students, and they prevented them from sleeping. They could do everything else normally. They ate normally, drank normally, hung out with their friends normally, and so forth. But during sleep time, they were monitored at all times and they had to go to the clinic and they could not sleep. They were constantly awakened and prevented from sleeping. These individuals developed psychosis like symptoms within a few days. Again, these were incredibly healthy, otherwise perfectly fine individuals in their 20s, and they developed psychotic symptoms resembling schizophrenia, brief psychotic disorders, and so forth. So you can imagine the impact that sleep has on us. And our brains are designed to sleep. So when people talk about having a sleep problem, I always say that's the hardest problem to have because our brain is designed to sleep. So it's almost like you're talking about swimming upstream if you're having sleep problems, right? So I will gladly do a full talk on that, and I welcome anyone else who wants to join me.
That will be a gift to the community. So thank you very much.
Wonderful. The next topic is to relax. This is going to really be a very personal journey of finding out how you particularly relax, right? Meditation has been found to be incredible. Mindfulness practice is also very, very, very helpful. Practicing yoga, breathing techniques, and guided imagery. These are very easy to learn to do. There are numerous online videos. We can even do them here. But just with your breath, you can actually reduce your heart rate. I coined the term at our clinic that you should be your own Xanax, right? Xanax is not gonna. Oh, Bonnie, how sweet. Sorry, I get distracted.
Sorry to interrupt you,
I
but
know,
I thought this was
no,
important.
thank you so much, Bonnie. How sweet. Um, the Now I can't remember what I was talking about.
We were
Um,
talking about you can be your own Xanax.
Yes, yes, you can be your own Xanax. And I actually train people to be their own Xanax because you can definitely reduce your heart rate, your breathing, and your thoughts very, very easily. It's all in your control. Okay. And we can talk about that when we talk about sleep, because a lot of times with sleep, the problem is a overactive nervous system, overactive brain, and inability to shut that off and doing all the wrong things while you can't sleep. Okay. And all the pitfalls that we
Perfect. So I would definitely set up a talk for this sleep. I want to quickly respond to Dan as well. Dan says cats are great relaxation tools. They are, but not Luffy. Luffy wakes me up at 2:30 at night and then I cannot sleep. So I have a complaint here to register.
thank you for that. I think we should get Luffy's sleep on regular cycle, and that will
That
probably fix your sleep problems, right?
correct. So I
Yeah.
actually talked with my doctor and I said, if I don't sleep well and complete hours, I become different. So he said, okay, fine, I'll give you sleep medicines. And so I have taken them for the last 2, 3 days because I just could not keep up with Luffy's time and then staying awake and then preparing for the lectures. And so I need my system to be stable. And
Mhm.
so for the last 2, 3 days, I've been very fresh.
Very good. So I want to add something to that. I would be very concerned if someone says, I have not been sleeping consistently for several days, but I'm doing perfectly fine. So when people say, I'm struggling because I haven't slept overnight, I'm like, thank God, because that would be a pretty significant issue. With sleep, there is memory consolidation, which is very, very important, restfulness, rehabilitation, DNA repair. I mean, we could go on and on and on about the benefits of sleep. So, yes, we should not be able to function the way that we usually function when we go several days without proper sleep. So, that's a
I had
normal.
started stammering. I could not speak words
Mhm.
after a week or so of this weird sleep pattern that Luffy did. Although now I think he may be waking up at 2:30. I wake up at 5 or 6.
You're like, I don't know what's going on with him, but I'm sleeping through the night. Maybe slip some of those pills in his food. Just a little.
So giving Luffy some so his doctor had actually given
I
medicines
remember.
to give him. It is such a hassle that I think just giving him medicine itself is a trauma for him and for us. We
Oh,
have to, he would claw you, and we cannot just, it's very difficult. So the best has been nowadays, we let him out during the day and he goes out, he doesn't go far, comes back, and then I think he gives me some time at night.
oh, okay, that's good. Yeah, he should get tired. That's another reason why a lot of people, I believe, started having sleep problems is they were not getting properly fatigued throughout the
Mhm.
day for their brain to feel tired enough to fall asleep. Because
That's true.
again, they were either not working at all or working very little. They were not going out too much and so forth. And they were riddled with anxiety, all the things that are hindrances for sleep. So, which is why,
Got
again,
it.
that was a huge contributor.
I'm
So,
working on it.
very good. So, again, I encourage all of you to at least try mindfulness practices, breathing techniques, yoga, and so forth. And if you have any questions about any of those things, we can talk some more about that. Seek and provide support. And why I say provide as much as seek is, and I think Dr. Bean will know, will speak to this as well, is when you provide support, sometimes you get way more out of it than whoever you're providing support for, right? It's not a selfless act. Okay, I will be the first one to say what you get out of supporting someone sometimes will surprise you. And you almost feel guilty because you're like, I can't believe I feel so good. And hopefully whoever you're supporting as well will feel great as well. But so do you. So reach out, seek support, but also look around and see if you can provide support to someone else. It's so good for the soul.
And I can attest to this. I think about it many times now. If I was not doing these talks, because it has started happening nowadays that people will reach out and say, you've been doing these talks for so long, why are you doing it, or how are you doing it, or what kind of an action you've done. And I feel that what I got in return of daily engagement, talking with audience, talking with people, just like we're sitting in our as much of a living room as this could be,
Uh-huh.
that has given a lot of support to me as well.
Indeed. Yeah, absolutely. So I encourage all of you to reach out to get the help that you guys need, but to also provide help. Look around if even if someone needs something to be picked up from the supermarket, that the smallest things, and if you're having a conversation with someone, that could be a huge deal for them as well.
So Dr. Samina Chaudhary is saying, I usually sleep for 5 hours. Is it okay?
So the thing about sleep is moving away from quantity of sleep, how many hours you sleep, to focusing on quality of your sleep. So if you're waking up after your sleep cycle and you're very energetic, you feel very rested, then you're done sleeping, okay? And you can get up and again, you'll continue throughout your day, and if you feel fine throughout the day, then that's a good amount of sleep for you. For a lot of people, they try to get 7 or 8 hours of sleep and they're still not rested. So move away from quantity of sleep to focusing on the quality of your sleep and getting restful night's sleep, which most of the time means spending more time in REM sleep or stage 3 sleep, and making sure that you're waking up and feeling rested after your sleep cycle.
Got it. Very, very good
I
answer.
hope
Thank you.
that's And then the last one, and possibly the most important one, is monitor your thoughts and evict any negativity from your brain. And we talked about this during the first time I was here, about also not being overly or unnecessarily positive. So you don't want to swing back from being very, very negative to being very, very positive either. I always describe it as looking through a lens, like dark black lens versus pink sunglasses. You don't want to have either one of those. You want to have clear uh, glasses to be able to see the world as it is, or see your situation as it is, and really focus on the thoughts, the words that you're communicating. We talked about some of the words that were used to describe certain things. Even I encourage you all, when you're reading articles or news stories or even YouTube videos, look at the words that people have chosen. Most of the time, those words, whether they were consciously or unconsciously or subconsciously chosen, they were chosen for a particular response. Okay. I'll give you one example. We've all been through this. During the first part of the pandemic, when they were trying to figure out what's a safe distance for social distancing, which, by the way, I also don't like. We use the term physical distancing as opposed to social distancing, because you don't need to socially distance at all. You just need to physically distance, right? So that, which is also another term that had a huge impact on people, social distancing. And if you switch it to physical distancing, it has a different term to your brain, and it means something different to your brain. So the early studies, when they were looking at how far do we have to be to prevent the transfer of COVID molecules and cells and so forth, and the infection. And the first studies showed 10, 12 feet. For some reason, 6 feet was picked. Now, I'm going to ask you to free associate to, and I'm going to look at the responses because I can see your responses. I'm going to ask you to please free associate what comes to mind when you hear the words 6 feet.
Man, this makes me scared when you said it. So that's 6 feet under.
That's correct. Death. At least in the United States, 6 feet refers to death. This is just my observation. I've not read it anywhere. I don't know if any. Thank you, Rima. Indeed, if any 6 feet under, correct. And this again, because I'm very, very sensitive to, people's words and the way they term certain things, and because these have a huge impact on your brain, and in turn your emotions, and in turn your behaviors, and in turn your surroundings. Okay, so it becomes full circle, right? So you hear something, your brain responds to it cognitively, it gives it a meaning, you respond to it emotionally, physiologically, and then you act a certain way. So I highly encourage you to pay attention to the words, not just the words that people are saying to you, but the words that you are saying to yourself. And if there's a lot of can't, won't, shouldn't, I want to warn you about these words. They have a very direct and powerful impact on your brain. And I want to ask you to examine and see, do they really belong in your brain? Are they 100% true? This is what I meant by evicting negativity, right? Because if you term something from I can't, so to maybe I could, that has a huge difference on your emotional state. And you'll also probably be more likely to try the thing that you think you could versus the thing you think you can't. Okay. So I really want to ask you to become detectives of the words that you say to yourself. We can talk more about this in future, the sleep one in particular, but I really want to encourage you guys to become it's my pleasure, Bambi. Hello. I want to ask you guys to become very aware of your thoughts to yourself in particular, and then from others secondarily. They have a huge impact. If you know the impact, you can control the impact. Okay.
Absolutely. And I'll give you my example. I've been giving my example, so I don't have to talk about somebody else's situation. In the very beginning of the COVID talks, it had become a change in my daily routine. One, we had the pandemic, and secondly, I was not doing medical student talks, and I was doing more of these talks, and I need to study and research and pull the data, and then I like to draw, so I have that extra homework for myself to draw. That is how my lectures are world's best lectures. So uh, there was a friend of mine um, who we all had become a little different during this time, as you have been discussing throughout the time today. And he had become very, very agitated for his circumstances as they unfolded in the COVID-19. And I had to, I really love him, but I had to clean myself afterwards from my thoughts that all the um, depression that he was going through. And luckily, we requested him to go to a doctor and he sought
Mm.
help and he's fine. But at that time, I was the sounding board. And I had to actively, as you said here, monitor your thoughts and evict negativity. I had to actively uh, kind of neutralize those seeds of thoughts that would be left in my head after having those discussions. And it was quite a homework for me.
Yes. If you recall a time when you were in school, particularly later in school, in medical school, you probably had the same feeling with medical students' anxieties around you, that you would absorb that anxiety. If you remember, especially around internship and residency matches, you would become so anxious and you would go home and you'd be tense and so on and so forth because you were carrying others' anxieties and so on. If you're not monitoring it, you're being impacted by it. There's nothing wrong with being impacted by negativity or stress or anxiety. I just want to ask you guys to become aware of it because not all of it belongs with you. Not all of it belongs at that high level. Again, all you have to do is change can't to maybe couldn't, and right away it becomes a different feeling. Right away, it changes your behavior and approach to the thing that you think you can't. So again, become more aware, become more in control. And it ties into again, the one thing you have control over is you. And a lot of people's negativity during this period of time became focusing on things they did not have control. They didn't have control over lockdowns, who worked, who didn't, and so on and so forth. The one thing you always have control over is your response to your environment. Nothing can change that. And you always have that. And you get that by monitoring your thoughts, monitoring your feelings, which result from your thoughts, monitoring your behaviors, which result from your thoughts, your emotions, and so on. So that sort of concludes it. I'm open to answering any questions that anyone has.
Thank you very much. So while Cool Beans have questions, although it's almost 2 hours, we should bring you for questions later on. But I wanted to share my observation of this talk. So many times in medicine, we say that if you hear the patient out without calling them crazy, that itself starts the healing process because they feel there is someone who's hearing me out, who believes that I have this problem. I am not the crazy one. And so, with this discussion, I think you, in a mass gathering, heard us, although you were presenting, but many of us would, I saw some of these symptoms to say, all right, I had them. And so to be able to recognize them and say, okay, I'm not alone,
Mhm.
that in itself, and then giving those healing and resilience, you have actually started a number of us on the healing path. So thank you very much for that.
Thank you. I sure hope so. I sure hope so. That would be a huge compliment. And thank you.
So let's ask you some questions as well. So Margaret says, thank you for everything and your kindness. Here is a question I saw. So meanwhile, in America says, Dr. Z, thank you for your comment about long hauler not being heard. It's very validating.
Thank you. I hope you continue to feel validated and continue to find healing. Absolutely.
So there are some good comments as well. So Rima is saying you are fabulous.
Equally so.
Mhm. So so I think that we probably have answered a lots of questions. So
One,
let's there's a question. Do you live in Alaska? Didn't think so.
no, but I do want to visit.
Yes. Yes, that's a nice place. So with this, there is a lot of there's a lot of folks who are very happy
Thank you.
and
I
grateful.
want to add something. Thank you, Helena. I want to add something regarding the everything that we talked about in terms of the mindfulness, breathing exercises, and so forth. Uh, practice is very important, and even monitoring your thoughts and evicting negativity. I always say, think of your brain as the most expensive real estate, right? You only have so much of it. There's only so much that can be in it. What do you want to have in it, and what do you not want to have in it? And whatever you don't want to have in it, you got to evict it. Give it an eviction notice, kick it out. Okay? And make sure that you only keep what you want in that very small, extremely expensive real estate, which is your brain. Okay? And the things that we talked about, monitoring your thoughts, mindfulness, breathing exercises, and so forth. Practice makes perfect. At first, you may fail a little bit, you may not realize it, you may start to feel anxious or sad or depressed. Use those as your cues because you'll recognize your feelings first before you recognize those underlying thoughts. Okay, it's really hard to ignore a pounding heart that accompanies anxiety, or the feeling of down that accompanies sadness. Okay, so use your feelings to recognize that you need to ask yourself, what's going on through my mind? Why am I feeling this way? Why am I anxious? Why am I depressed? And get really good at being able to identify those. And you do that with practice. And you get really good at it the more you practice. If you remember when you were first learning how to drive, or in Skyfrog's case, when you were learning how to fly, remember how you had to think about all the steps necessary? And then after you've been doing it for a while, you don't think about it. Your eyes go where they need to go, your hands go where they need to go. When, let's say, you need to make a change of a lane or anything else, you first do it by very, very conscious effort, and then it becomes automatic. So think about practicing these things. I, for one thing, several other clinicians that I know can literally lower their heart rate on a cue. They can relax on a cue with practice. Really nothing special about us. Just practice. The more you practice, the better you'll get at it. And you know that because you've got skills in other areas, and that's how every single skill is learned, through practice. So
Thank you so much. This is such a precious talk, such an important talk, that not only there is a session within this talk where you heard us, and then there is a session to get us started for the healing as well. Two question, I am afraid they may be longer answers. So if that is the case, we can make them pending. But I want to show you the question. One
sure.
is any insomnia tips, and second one is depression, what to do.
Okay. Two things. I'll answer the second one first, if that's okay. Depression, what to do. In this country, we use the word depression interchangeably with sadness. Depression, I always think about clinical depression. That's a diagnosis. So I always keep that separate from sadness. So if you're feeling sad, down, and so forth, um, reach out for some help if you need professional help. Depending on where you are in the United States or anywhere else. Again, the one thing that I have to say that a lot of public health officials did is make mental health treatment more available. So, depending on where you are, please reach out to a professional for some help. Talk to a friend who can also help you with that if you feel comfortable, with a family member, and so forth. If you're talking about depression as a diagnosis, first, I would highly encourage everyone not to self diagnose. But if you feel like it is such a significant sadness that it has resulted in depression, then definitely reach out to a licensed professional in your state, in your country, wherever you are. Depression, anxiety, PTSD, these are highly treatable illnesses and issues, and you should not suffer without at least reaching out for some treatment, because again, very, very treatable these days with very minimal effort. So please look into that. And then I want to answer the insomnia one. Very few tips. So I hesitate to give tips because it's so involved, but just a few of them. Put your phones away at least an hour before you're going to sleep, or at least do not look at a screen within an hour of going to sleep. The light emitting from most of our screen devices is very, very bad for sleep and the sleep cycle, and it interrupts it completely. Get rid of any clocks in your bedroom, and do not look at a watch or the time throughout the entire time you're asleep. I always say that if your alarm hasn't gone off, it's not time to get up. So you should be trying to sleep regardless of what time it is. So I ask everyone to actually not even take your cell phone into the room. Put your cell phone outside of your bedroom. Do not reach for it, especially in the middle of the night, and do not look at a clock when you get up in the middle of the night. Um, Obviously, steer clear of any caffeinated drinks, including decaf tea, because it includes caffeine, and any high sugar drinks at least past 4 o'clock in the afternoon for you. If you tend to go to bed at 10 or later, if you go to bed earlier than that, you obviously want to move that clock up to 3 o'clock, 2 o'clock in the afternoon, and avoid all caffeinated drinks. I hope that's enough tips, but I want to make it a lot more of a comprehensive talk.
Thank you very much. And with this comment, Skyfrog says very high likes tonight. Thank you
Uh,
so much.
Thank you so much as well for having me and all the cool beans. I love being in the audience seat as well. So I missed you guys in the chat today. Thank you so much. I hope it was very useful for you guys, or at least slightly useful.
This was huge, not slightly useful. This was huge. I think this is timely talk. Um, I think that there are some actions that were useful before as well, but as the pandemic is finishing, this is a very important talk to start recognizing these things as cost benefit analysis that we keep doing all the time. So thank you very much for this.
My pleasure. Truly, such an honor. Thank you for having me.
Thank you. So, Cool Beans, thank you very much. We've gone on for about 2 hours. Please share it with family, friends, loved ones, whoever can benefit. I think a lot of folks. And if they feel that this is longer, just ask them to go to the later part and at least see the solution part of it. That would be very, very useful as well. Some folks would benefit from from early part to see that this is recognized, that this is happening and they're not alone and they're not the only case for this, or it's not their embarrassment that this is happening. So with this, thank you very much all for being here. Thank you very much, Dr. Zara Ashekian, to be here, and I'm going to request you once again for further talks.
Thank you so much for having me. It's always an honor. Bye bye, everyone.